Okay, so we talked about the loss of taste and smell. However, I want to remind you that that symptom is one symptom that's part of a larger problem, and that is the problem of the damage to the blood and the spike proteins accumulating in areas that are damaging the vessels and the tissues. Okay, so let's back up. Initially, we had this bug in the very beginning. We knew there was an immunological stage. That is defined by the body aches and fever chill part of the presentation. And initially, that was actually pretty mild. Even in 2020, it was mild. In fact, actually, currently, with the current state of the bug, that stage is more severe with more body aches and sore throat and headaches and all those types of symptoms. But initially, it was very mild. A lot of people complained about having a fever for even a day. However, the second stage was how this thing was damaging the blood, and that could go on for months, and that's where the more serious complications occur. In the beginning, we didn't know what was going on, but we could see it because of the signs and symptoms and the presentation of the purpling of the lips and the tongue, which was much more obvious in 2020 than it is currently, but nonetheless, it's still showing up. So in the beginning, this blood damage was going on, and the patients were coming to us from the hospital that was offering no treatment at all. The hospitals were taking the people in, at least in our area, and not treating them with anything. But they were doing chest x-rays and their lungs were empty. So I knew that going into it. They can't breathe, and many of them were quite severe, but there's nothing in their lungs. And so I started to see these signs and symptoms and realized that the damage to the blood was occurring, and it was becoming sticky, stagnant, and deoxygenated. And so these patients were having anxiety, they were having rapid heart rate or tachycardia, they were having all of these symptoms worse with exertion, and this is very peculiar for a cold flu type situation. So nonetheless, the moment I started treating that part of it, they were all getting better. And that still is a missing link. A lot of people are talking about zinc and D and all kinds of therapeutics, but those are largely directed at the immunological part of the battle. And I wish I could say that there was a correlation between the severity of that immune response and the severity of the post-bug blood damage. In other words, if you had a mild case with the immune side of it, then you're going to have a mild case with the blood damage. But that is just simply not what we saw. We saw so many people who had extremely mild onset, body aches, fever, chill for a day, yet they're in serious trouble with their blood system going on for months and they can't breathe, etc., etc. So we started treating people, we started gathering a high degree of confidence because our protocols were so successful. And now we're getting batches of people that hadn't seen us initially, but now they just weren't better. So I was calling this a post-bug blood damage case, less immune protocol, mainly focused on the blood. And that's where one of those symptoms is the loss of taste and smell, and I explained the mechanism in the last video. However, that same mechanism is happening in multiple areas of the body. So if we think of blood flow, what else could we experience? For example, it makes sense, the shortness of breath and the worse where the exertion, because the blood's damaged and the heart's having to beat faster and work harder to deliver nutrients and remove waste. But also we could think of things like headache and tightness in the chest, even heart pain. We could also think of things like hair falling out. Now, why would hair fall out? Because the microvascular system becomes affected. All the smallest vessels where nutrients are feeding those tissues. And so we call that a microvascular coagulopathy. You know, can we even get small complete breakdown of blood flow or ischemic patterns in these microvascular? This is not all that unusual when we're looking at a type 2 diabetic case, which is also a blood vessel inflammation patient category. However, they're getting it from the sugars affecting their blood vessels. In this case, we're getting it from the spike protein, but nonetheless, we're going to see a huge parallel of those type 2 advanced diabetic symptoms and the post-bug blood damage, right? So the hair's falling out. You could see blurring of vision happening with a lot of these post-bug blood damage cases. Tinnitus is not that uncommon as we're affecting the liver and the kidneys. There's pressurizations, including elevated blood pressure, and even things that you might not think of like erectile quality dysfunction, which is very unusual for a cold and flu. You may not feel well, but now you're better, especially with the young men having this symptom. This does not affect the sex drive. The drive is unaffected. However, the quality of the erection is because it's blood flow related. Well, nonetheless, this is all going to require the same type of strategy. We got to move the blood, maybe even thin the blood. Can prevent clots or something more serious, but ultimately we got to move the blood and find some way to protect the endothelial lining, which we do with plant medicines, and if we can, remove the spike proteins. Well, during that time period of treating those post-bug blood damage cases in 2020, we started noticing, our team, that when a female had her period, she would have a dramatic improvement on those blood damage symptoms. All of a sudden they'd get better. We're about to start treatment. They have their period and they get better anyways. So it led me to believe that they're actually dumping some of this damaged blood. Very curious, almost like bloodletting of the ancient times, right? I know, bring out the leeches. So what did I start advising? My patients in this category who are no longer sick to go donate blood if they were non-menstruating. So men or menopausal women, this kind of thing. In fact, many people saw or heard of the occurrence of even menopausal women starting to bleed. It's as if the body wanted to get rid of something. Or people having nosebleeds, which might even be something to consider letting a little bit go and let yourself bleed a little bit. But if you have any questions, of course, seek medical help, especially if you've taken any kind of blood thinner. It just might not stop, and that can't be good for you. One side note to donating blood or relieving blood, if your lips and tongue are pale, it is a sign of anemia, or at least subclinical anemia. Those are the patients that probably should not go donate blood or lose too much blood without at least trying to replenish or build the blood. Let us know if you have questions about that. Point being here is that we have the stage 1 of the bug, which is going to be the immunological stage. Not much going on there. Stage 2 is going to be the blood damage. That's what this is all about. And that's also going to show us where we want to protect ourselves. Where we want to have better outcomes is in protecting that cardiovascular system. And there really has been no information or encouragement for this country or any other country to start to improve their cardiovascular health or reduce the risk factors for those pre-diabetic patterns, which are so rampant and have such a strong relationship to a poor bug outcome. So nonetheless, we also have possibly a few other stages that we don't know, right? Stage 3, stage 4, could be autoimmune, could be prion, could be stealth pathogen relationship of this bug within us to the body. And that's something that I'll cover in another video. For now, I just want to give you some more to think about the blood system, because that's what this is all about. And you let us know if you have any other questions or if we can help you. Take care, bye.